Have you ever wondered if the stroke that could change your life forever is already sending warning signs today? What if the numbness in your hand, the sudden dizziness, or the unusual fatigue you've been blaming on aging is actually your brain crying out for help? According to medical studies, nearly 1 in 4 adults will experience a stroke during their lifetime, and many people who suffer a major stroke report having warning symptoms days before it happened. The tragedy is that most of those signs were ignored. Before we begin, welcome back to Healthy Wisdom for Seniors, the channel dedicated to helping adults over 50 protect their health, stay independent, and enjoy a longer, stronger life. If you're serious about healthy aging, take a moment to subscribe, like this video, and turn on notifications. Every video we create is designed to help you recognize dangers early and make informed health decisions that could one day save your life. Now, let's talk about something that every senior and every family member needs to understand. A stroke doesn't always arrive without warning. In many cases, your body starts sending signals days or even a week beforehand. The challenge is recognizing those signals before it's too late. And make sure you stay until the end because the warning sign most people mistake for normal aging may surprise you. Let's begin with number 10, sudden fatigue. We're not talking about feeling tired after a busy day. This is an overwhelming exhaustion that appears suddenly and feels completely out of proportion to your activities. Many stroke survivors later report feeling unusually drained, as if all their energy disappeared overnight. If you're suddenly exhausted without a clear reason, especially when combined with other symptoms, don't ignore it. Number 9. Unexplained personality changes. Family members often notice this first. Someone who is normally calm may suddenly become irritable, anxious, confused, or emotionally unstable. These changes can occur when blood flow is reduced to parts of the brain responsible for mood, behavior, and emotional control. If a loved one suddenly seems like a different person, take it seriously. Number 8. Severe headaches that appear out of nowhere. This is especially important for people who rarely get headaches. A stroke-related headache is often described as the worst headache of someone's life. It may feel like an explosion inside the head, arriving suddenly and intensely. If a severe headache appears without warning, seek emergency medical attention immediately. Number 7. Vision problems. This is one of the most commonly overlooked warning signs. You may notice blurry vision, double vision, blind spots, or difficulty focusing. Some people describe it as looking through a foggy window. Others notice that part of their field of vision suddenly disappears. Because vision problems are often blamed on aging eyes, many people delay seeking help. That delay can be devastating. Number 6. Numbness or tingling on one side of the body. This symptom often affects the face, hand, arm, or leg. The key word is sudden. If you suddenly feel numbness or tingling on one side of your body, especially if it appears together with weakness or dizziness, your brain may not be receiving adequate blood flow. Many people dismiss this as a pinched nerve or poor circulation, only to experience a major stroke days later. Now here's something critical. A warning stroke, also known as a transient ischemic attack or TIA, often produces the exact same symptoms as a major stroke. The difference is that the symptoms may disappear after a few minutes or hours. Unfortunately, many people take that as a sign that everything is fine. It isn't. A TIA is often your last warning before a life-changing stroke occurs. Studies have shown that nearly 1/3 of people who experience a TIA will go on to suffer a major stroke if the underlying problem is not addressed. And for many people, that major stroke happens within just 7 days. Now let's continue with the 5 most dangerous warning signs. Number 5. Confusion and cognitive changes. Have you ever suddenly struggled to understand a conversation? Forgotten familiar information? Had trouble making simple decisions? These are not always signs of aging. A stroke can disrupt blood flow to areas of the brain responsible for memory, comprehension, and judgment. If confusion appears suddenly, it should never be ignored. Number 4. Loss of balance and coordination. Many seniors worry about falls, but stroke-related balance problems often feel different. They appear suddenly and dramatically. You may stumble unexpectedly, struggle to walk in a straight line, or feel as though the room is spinning. If your balance suddenly changes without explanation, it could be a warning sign that your brain is in trouble. Number 3. Difficulty speaking. This is one of the most recognizable stroke symptoms. You may know exactly what you want to say but find yourself unable to form the words. Speech may become slurred, slow, or difficult for others to understand. Some people suddenly struggle to understand language as well. If speech changes occur suddenly, call emergency services immediately. Number 2. Facial drooping. Look in the mirror. Is one side of your face lower than the other? Does your smile appear uneven? Can you raise both sides of your mouth equally? Facial drooping is one of the classic warning signs of a stroke and often appears before more severe symptoms develop. And now number 1, the warning sign doctors consider one of the strongest indicators that a stroke may already be underway. Sudden weakness on one side of the body. Your arm may feel unusually heavy. Your leg may suddenly become difficult to move. You may notice weakness in your face, hand, or entire side of the body. This symptom often appears without warning and should always be treated as a medical emergency. The faster treatment begins, the greater the chance of preventing permanent brain damage. So what increases your risk of stroke? High blood pressure remains one of the biggest risk factors. Smoking damages blood vessels and increases clot formation. Excessive alcohol consumption raises risk. Physical inactivity weakens cardiovascular health. Chronic stress increases inflammation and blood pressure. And perhaps most importantly, insulin resistance, type 2 diabetes, and metabolic syndrome silently damage blood vessels throughout the body for years before symptoms appear. The good news is that many strokes are preventable. Regular exercise, healthy nutrition, quality sleep, maintaining a healthy weight, controlling blood pressure, avoiding tobacco, limiting alcohol, and managing blood sugar can dramatically reduce your risk. Remember, your brain is your most valuable asset. It controls your memories, your independence, your relationships, and your quality of life. Protecting it should be one of your highest priorities. If you experienced any of these symptoms recently, even if they disappeared, speak with your healthcare provider immediately. It could be the warning that saves your life. Before you go, tell us in the comments, how old are you, and which of these warning signs surprised you the most? We read every comment and love hearing from our Healthy Wisdom for Seniors family. If you found this video helpful, please subscribe, like this video, and share it with someone you care about. You never know whose life this information might save. Thank you for watching Healthy Wisdom for Seniors, and remember, the best time to protect your health is before a crisis happens. Stay healthy, stay informed, and we'll see you in the next life-changing video.